Welcome to another episode of You Can't Handle the Tooth with the Floss Boss. I am Dr. J, and I just want to say, first of all, thank you to everyone that's been watching the previous episodes. We've had a couple of episodes, had over 1,000 views, and so I'm really glad about that. I hope we're providing a good service for you, just to provide information about different topics in dentistry. And I get emailed a lot. I mean, I got notices yesterday from Instagram from someone from Vancouver and somebody else from Saudi Arabia that's asking questions about dentistry. So that's the point of this, is to help people along. I even get questions from dentists sometimes that ask me about different materials we use, the techniques. But I'm just real excited to be able to offer this through Facebook Live. I got Katie helping me today, so really excited about that. And first couple of things you should know: this is not in any way me practicing dentistry around the world. I mean, it's just me to answer questions, general questions, so that you can either find a dentist or go back to your dentist that can help you, with any dental concerns or issues that you might have. The subject for today is dental implants. And this is a question I have a consult with patients about nearly every single day. And premature tooth loss comes into play for many adults, and they always want to know how to replace teeth. And you can replace them in several different ways, with partials, dentures, bridges, where you connect two crowns on the adjacent teeth and a fake tooth goes in the middle, and then of course implants, where a tooth comes out of the bone and an implant gets placed down in the bone and a crown goes on top. Now I have a little model here to show you exactly what I'm talking about. So if you can help me make sure that I'm zoomed in right here. Can you see this pretty good?
Pretty good, yeah.
So in here are implants. If you can't see this, I apologize. I can post some pictures later just to make a comment and let me know if you want me to do that. But the implants go in the bone, and then a little bridge or a crown will go right on top, and it looks and feels just like your teeth. It's the longest lasting tooth replacement treatment in dentistry, and it is what, they've done studies where they say with a partial, how well do they feel like they're your own teeth, and it's like less than 50% would say that they do. And then with the bridge, it's more closer to 80-85%, but with implants, feeling more like they're the teeth that you were born with is upwards of 95-98%. So it's a really, really good tooth option to make you feel like they're actually your teeth. We have, so why an implant? When you take a tooth out, the bone that was there surrounding the tooth will collapse and it will shrink. And so the way to help preserve that bone, to keep it plumped, to help you make sure that your face doesn't have that slightly sunken in look as you age, implants are the way to go. Now, we get lots of questions about implants, and so I have like the top 4 or 5 questions. Make sure we hit them. And so, Katie, what's the first question?
Do they hurt?
Do they hurt? This question came in. I'm assuming they mean, does the placement of the implant hurt? And what I can say is the extraction hurts worse. The post-op discomfort of an extraction is worse. Now, I'm not saying this because I've had an implant. I've been fortunate enough not to have one, but I've placed enough and I know enough people to be able to tell you these facts. Hurts worse. The extraction hurts worse. Post-op tenderness and stuff is worse with an extraction. The implant, without exception, I've been placing implants for 6 or 7 years, and the most people ever need post-operatively is like some Advil. So that's a treatment that can be done, and as long as you're not sedated for it, you're back at work that afternoon or the next day even, no problem. So do they hurt? No more than, say, getting other ordinary dental work. It's not extreme. What's next?
Question: how long should I expect them to last?
That's a great question. So here's a good way to answer that. People say, how long does a bridge last versus an implant? And so the best way to answer that is if you take 10 patients and you place a bridge in each one of those patients, and then you monitor them over the course of 10 years, about 7.5 of them will still be in place in 10 years of the bridges. If you take 10 people and you place an implant in each person, one implant, and you monitor them after 10 years, about 9.6, even 9.8 of them will be in place. So the implant will last much longer. The implant itself that goes down in the bone, it should last the rest of your life. You should not have a problem. If that implant is integrated well into the bone, then you shouldn't never have a problem. Now the crown that goes on top is a different story. That will have problems like any other teeth or any other crowns. You can't get decay on it, but they can wear, they can chip, and so you may have to update the crown at a normal life cycle for a crown, but the implant itself should last the rest of your life. Any comments or anything that you can see?
Not currently.
Okay.
I have one that says, wow.
Wow. All right, so what's the next question? Number 3.
Are there any complications I should be?
Complications. Always have risks, particularly with surgery. So you need to think about things like, are you on any blood thinners? Do you have any healing complications whatsoever? Any diabetes or any peripheral constriction conditions that would prevent your body from healing normally? That's something to consider. Your chances of failure are higher if you are diabetic or if you're a smoker, but they're not so high that you would preclude yourself from having an implant. It's just a little bit higher risk. There are also some medications you could be on, the bisphosphonates, Fosamax, and drugs like that. Any of those bisphosphonate drugs that help with your bone density, those will always definitely be a flag and could be a contraindication for you. But as far as the intraoperative surgical problems, there's always complications and risks with any surgery. A good doctor is going to make sure that the implant's nowhere near any nerves, and so that shouldn't be a problem, although sometimes it can be. You shouldn't have, when I've ever seen implants that fail over time, after a few weeks of it trying to heal, sometimes the bone just won't integrate. Like any other implant that you might get in your knee or your hip, things can fail. The body can reject these foreign parts. They're titanium, though. They're definitely an inert metal for the body. But complications could be some swelling, could be some bruising, although I've rarely ever witnessed that in the surgical complication of placing an implant. So you'll have a little bit of a wound where you place the implant that's healing, sometimes some sutures, sometimes not, but that's about it. Next.
Do I have to be sedated to have an implant done?
That's a question I get all the time. Do I have to be sedated? And the answer is no, absolutely not. I would say most people that get implants are probably sedated, and most people that think of implants think, oh man, I better be asleep for that. 90% of the implants that I place are placed on people with local anesthetic, and if you can withstand getting a crown done on your teeth, then you can get an implant. If you're an anxious person, particularly about dentistry, if you have high anxiety at the dental office, you may want to get sedated no matter what they're doing, whether it's a filling or a crown. But if you can get a crown, then you can get an implant, no problem. So there you go. You do not have to be sedated.
And our last question actually just got asked on Facebook Live. Miss Carter said, would specific dental insurances cover the procedure, or are there any payment plans available? Also, what's the average cost for implants?
Great. And I think that the cost was one of the last questions we had. What was her name?
Carter.
Carter. Great question. So insurance, your insurance, dental insurance, I should do a whole video on dental insurance. In fact, I want you to make a note of that because we're going to do that. Dental insurance can be a little beast. So let me make it very simple for you. Most dental insurances have a maximum annual payout of like $1,500. That's about average. Some are $2,000. Some of the worst ones are around $1,000. It's about $1,500. And most dental insurances have a provision to cover a portion of implants and the crown that goes on top. So you got to look at that. The implant and a crown, the cost of them on average, I would say, if you take into account the extraction, any bone grafting that needs to be done, the implant placement that needs to be done, the crown that goes on top, the entire process can cost somewhere between $4,500 and $5,500, which is not cheap. But it could last you a long, long time, which would be a good investment in your future. But the insurance is going to max out at $1,500. So the rest of it is going to be out of pocket. All right, and so if they cover the implants, they'll cover a portion of the implant, they'll cover a portion of the grafting, they'll cover a portion of the crown. They will max out at $1,500, and then $2,500, is that my math? $3,500? $3,000. $3,000 will be out of pocket. Okay? All right. Is that it?
That's all the questions.
Okay. So we covered some dental implants, basic dental implants. Please, please, please share this video with your friends so that they can get some information on dental implants. People want them all over the world, particularly all over the United States, and so this may be helpful for them. You can follow us on YouTube. We're certainly on Instagram and all the other social media outlets. This is Dr. J, the Floss Boss, signing off, and thanks for joining us for You Can't Handle the Tooth.